Heart failure has various definitions, some more complicated than others. But put in its simplest terms, the heart is primarily a very strong muscular pump. And in heart failure, the strength of the muscle contraction and the efficiency with which the heart as a pump works becomes abnormal. It becomes reduced for whatever reason. And that is commonly associated with symptoms such as breathlessness on exertion, excessive fatigue, reduced exercise tolerance, and the manifestation of swelling of your limbs, particularly your lower legs. There are various causes of heart failure, and it's important to appreciate this because depending upon the cause of your heart failure, that will depend, that will then determine the treatment for that heart failure. And some causes are much more treatable than others. But in the Western societies, the commonest causes of heart failure include underlying ischemic heart disease caused by coronary artery disease. So essentially blockages occurring in the arteries of your heart. But other causes can include diseases of your heart valves leading to leaky heart valves, for example. And there are also inherited causes. And even another distinct cause can be excessive consumption of alcohol can eventually lead to heart failure. So as I've alluded to, the treatment of heart failure will depend to some extent on the cause that has been identified. For example, if it's due to a leaky heart valve, then that leaky heart valve needs to be corrected, for example. If it's due to coronary artery disease, then that is investigated. And if you improve the blood supply to the heart, then you should have a good chance of improving your heart function in many cases. If it's due to excessive alcohol consumption, then obviously reducing or better still abstaining from alcohol consumption can again improve the heart function. But while patients are receiving investigations into what is causing their heart failure, they will be started on a number of medications, drugs. And those drugs have been shown in very large properly controlled and conducted scientific trials to improve the pumping efficiency of the heart and thereby improve symptoms whilst patients are being investigated for other correctable causes. So people are started on a number of medications and they undergo investigations to discover this, if there's a specific cause or main contributor factor to their heart failure. And then they're reassessed after they've been put on these medications to see how much their heart function has improved. And at that stage, some patients may be amenable to further treatment options. So this is something that is very important, that I think that patients do appreciate at the beginning when they see cardiology teams, but can sometimes get forgotten. And that is that if you have a diagnosis of heart failure, you are often instructed in the beginning that it's very important to take your medications, particularly in heart failure, because these tablets have been shown to improve heart function. Now, it's not fun to take tablets because tablets can have side effects. But if you do have an established diagnosis of heart failure, then these medications would only have been started for you if it is deemed definitely in your best interest. So it's important for patients to take their medications. Obviously, some medications will be more inconvenient than others. People with heart failure are often on diuretics, which helps to reduce swelling of their limbs and improves their breathing. Diuretics act by increasing your urinary output. So you have to go to the toilet more often. And that, understandably, can be quite inconvenient for many patients. But you have to weigh that up against the fact that if you don't take these diuretics, then your breathing will become much worse and your limbs, your legs will become much more swollen. So it's a benefit, it's a balance between the benefits and the to some extent, the inconvenience that caused by some of these tablets some of the time. The other very important aspect that I think it's important to reiterate and to stress on a continual basis that patients must keep an eye on their weight. It's important to get an accurate scales, weighing scales, digital, and to keep an eye and keep a regular check of the body weight, because the other important aspect is that patients with heart failure are often told that they must restrict the amount of fluid they drink, roughly around 1.5 liters, except if it's a very, very hot day. If it's a very hot day, then you're going to be losing more water through sweating, so you can take a bit more. But there will be some form of stipulated restriction on how much fluid you drink. The reason for saying that is that people with heart failure, because the pumping efficiency of the heart is not 100%, they have a greater vulnerability of retaining fluid. So if they drink too much, that fluid will eventually go to their legs so that their legs swell up more, and eventually their breathing gets worse. So it's important for patients to stick to fluid restriction and to keep an eye on their weight, because if their weight is gradually increasing week after next, then that is their first sign that they're going to get into trouble eventually with that fluid accumulating and causing increasing symptoms. Well, if you look at the literature, and patients understandably do their own internet searches, then heart failure is a serious condition. But the positive point is that in the last 30, 40 years, cardiologists have developed so many different treatment options for heart failure, which include drugs, and new drugs in the last few years have also been added. And in some patients, they can be amenable to having a special pacemaker put in, which can improve their heart function. And other patients go on to have operations to improve the blood supply to their heart. That improves their symptoms and their outlook. And yet other patients will have leaky heart valves, what we call heart valve disease. And when those patients undergo correction for that leaky heart valve, that can also improve their outlook in heart failure. So a serious condition, but the positive points are that there are many treatment options which can benefit many patients.